Hi, my name is Carrie Griffin, and I'm a student at Auburn University in the Family Nurse Practitioner program. Today, I'm going to be talking about nurse practitioners and what a nurse practitioner is. First, we'll discuss the education of a nurse practitioner versus a doctor. So, nurse practitioners, they begin as registered nurses. So, they obtain that bachelor's degree in nursing, which is a 4-year degree. And then after graduating as a registered nurse, after graduating with a bachelor's degree, they sit for boards and become a registered nurse. Then they obtain clinical experience as a registered nurse to further their education. It is not required to obtain the clinical experience, but definitely recommended. Then the nurse will obtain a master's degree in nursing, which is an MSN, or a postmaster's degree, a doctorate of nursing. So altogether, the nurse practitioner typically does 6 to 8 years of school. A doctor, however, they do a bachelor's degree in a pre-medicine major. Then they do 4 years of medical school, and then they do 4 years of residency, or even longer, depending on the type of physician that they choose to become. And then they begin practicing as a physician. So they're looking more at about 12 years. So the main differences in nurse practitioners and doctors obviously is the education and the approach to practice. So a nurse practitioner really is trained to concentrate on more of a holistic approach to care, providing care to individual patients, families, and communities. So the nurse practitioner will actually look at the whole picture. And physicians are really trained to mainly focus on diagnosis and treatment. So what does a nurse practitioner actually do? So most often the most often used skills of a nurse practitioner are performing physical examinations, diagnosing and managing acute and chronic conditions, providing patients with health promotions and disease prevention information, ordering, conducting, and interpreting diagnostic tests, prescribing both pharmacological and non-pharmacological therapies, and educating and advising patients on health conditions, risk, and treatment options. This is a map of the state practice environment. Each state has their own laws, and as we can see, there's kind of color coordinated here. The full practice states are in green, and these states actually allow the nurse practitioner to evaluate patients, diagnose, order, and interpret diagnostic testing. They can initiate and manage treatments, including prescribing medications and controlled substances. And they do this all exclusively under that state board of nursing. So they are not required to work with a collaborating physician. The yellow states are reduced practice states, and they actually allow the nurse practitioner to engage in at least one element of nurse practitioner practice, but they require a career-long regulated collaborative agreement with another healthcare provider in order for the nurse practitioner to provide patient care. And then the red states are restricted practice. And these states actually restrict the ability of the nurse practitioner to engage in at least one element of nurse practitioner practice. So they require career-long supervision, delegation, or team management by another healthcare provider in order for that nurse practitioner to actually provide patient care. So they have to actually work with a collaborating physician. And Alabama is included in that restricted practice. So this diagram here, we're going to talk about the primary care physician shortage and why nurse practitioners are really so important nowadays. So due to the increase in the aging population, the increase in population in general, and insurance expansions, it is projected that by the year 2025, there will be a primary care physician shortage between 14,900 and 35,600 doctors. So really, they can say that the increase in population is really putting a demand for about 33,000 more doctors. The aging population is actually given about a 10,000 doctor demand, and the insurance expansion is about 8,000. So we're really factoring in on about 52,000 doctors that are needed by the year 2025. So, how can nurse practitioners really make an impact on healthcare today? Well, almost all nurse practitioners are trained to practice in a primary care setting. So, most practitioners are trained to, do family care, adult medicine, pediatrics, women's health, gerontology, which is caring for physician or patients 65 years of age and older. And a big thing that's coming around is the psychiatric nurse practitioners. Nurse practitioners are more likely to work in urban and rural areas and actually are more inclined to care for uninsured patients and other at risk groups. And nurse practitioners actually provide lower cost of care for patients than physicians. So the main takeaways that we've learned today about nurse practitioners. Um, with the aging population, increase in population, and financial burdens of healthcare costs today, nurse practitioners can actually positively impact our healthcare in the future. And how is this? Nurse practitioners can help improve access to healthcare for individuals by providing more affordable healthcare. Nurse practitioners can help alleviate the primary care provider shortages, and they can provide a more holistic approach to patient care, providing care to the patient as a whole. So they can promote healthier lifestyles and prevention efforts through education and advocacy for patients, families, and whole communities. And the nurse practitioners can establish a trusting relationship with patients and families, which provides better patient satisfaction. These are my references, and I hope you enjoyed.